I didn't realize I was burnt out until I left clinical practice. And then all the symptoms disappeared. The annoyance, the lack of interest, the exhaustion that sleep couldn't fix. Gone. And that's when I realized, oh, that was burnout. Hello, I'm Dr. Felix Boecker, and today we're talking about burnout, how to recognize it before it destroys you, and what to do about it. Stay until the end for actionable tips and strategies you can implement today. Welcome to In Search of 42. Here's the problem with burnout. You might not recognize it while you're in it. You think you're just tired. You think you're just having a bad month. You think everyone feels this way. You think it's normal. And by the time you realize it's burnout, you're already deep in it, already struggling, already considering leaving medicine, already fantasizing about walking away from everything. That's the danger of burnout. It's insidious. It creeps up on you. And before you know it, it's consumed you. So today, I'm going to help you recognize burnout before it's too late. I'm going to give you the warning signs, the red flags, the early indicators that something is wrong. And I'm going to give you strategies for intervention. What to do when you recognize burnout, how to address it, how to recover. Because burnout doesn't have to be inevitable, and it doesn't have to destroy your career if you catch it early enough, if you take action. So, let's talk about it. Let me tell you about my experience with burnout. Yes, I have experienced burnout. It looked like a lack of interest in anything related to medicine, annoyance at everything, administrative tasks mainly, filling out forms, dealing with insurance companies. Sometimes it was patients not following through with plans, going against what we discussed. Phone calls. I've always hated phone calls in general, but it was worse during my burnout. Everything irritated me. Everything felt like too much. Everything felt pointless. It was difficult to tease out at first if it was just a piece of my depression or something else, because depression and burnout share a lot of symptoms: lack of interest, irritability, exhaustion, cynicism. They overlap significantly. It wasn't until I left clinical medicine in 2024 that I started to not have these symptoms. And that's when I recognized it as unique burnout symptoms. When I stopped doing clinical work, the annoyance went away. The irritability decreased. The lack of interest in medicine persisted, but the acute suffering stopped. That's when I realized that was burnout. Not just depression, but burnout. Looking back, there were warning signs I missed or ignored. The gradual loss of interest in medicine, the increasing irritation with administrative tasks, the fantasies about doing something else entirely. But I didn't recognize them as burnout at the time. I just thought that's how medicine was, that everyone felt that way, that it was normal. It wasn't. Here's something important. I feel like I am always at risk for burnout. Medicine just doesn't interest me anymore. It never really captivated me. And now I'm looking for a new challenge in life, something that actually engages me, something that aligns with my values and interests. I'm more aware of my previous symptoms now, and I can look out for them. I can monitor myself. I can recognize when I'm starting to feel that annoyance, when I'm starting to lose interest, when I'm starting to feel exhausted in that particular way. And I can take action before it gets bad. So, what am I doing? Well, I'm taking action before it destroys me, before I'm completely depleted. That's the difference between recognizing burnout early and letting it consume you. When you recognize it early, you can do something about it. But when you ignore it, it gets worse and worse until you cannot function anymore. So, what does burnout look like? What are the warning signs? Let me break them down. There are physical signs, sleep disturbances, either sleeping too much or not enough. For some people, they can sleep despite being exhausted. For others, they sleep constantly and it's never enough. Appetite changes, usually a depressed appetite, but some people are stress eaters and start eating more. Health in general becomes less important to take care of. You stop exercising, you stop going to the doctor, you ignore symptoms, you let yourself go. Chronic exhaustion that sleep doesn't fix. You can sleep for 12 hours and still wake up exhausted. That's not normal tired, that's burnout tired. Frequent illness. Your immune system is compromised from chronic stress. You're getting sick more often. You're taking longer to recover. Then there are the emotional signs. Cynicism. You become cynical about medicine, about patients, about the system. You start making dark jokes. You become bitter, detached. You stop caring. You just go through the motions. You don't connect with patients anymore. You don't feel anything. Irritability and annoyance. Everything bothers you. Patients annoy you. Colleagues annoy you. Administrative tasks annoy you. Everything feels like too much. A lack of satisfaction. Even when things go well, you don't feel satisfied. You don't feel accomplished. You feel empty. A loss of meaning. You can't remember why you went into medicine. You can't find purpose in your work. Everything feels pointless. The behavioral signs, paying less attention to details, making more mistakes, cutting corners, not being as thorough, avoiding meetings or interactions. You don't want to engage with colleagues. You skip meetings whenever you can. You avoid conversations. Spending less time at work, coming in late, leaving early, taking more sick days, not going above and beyond anymore, less investment in professional development. You stop reading journals, you stop going to conferences, you stop learning, you stop caring about being better. Substance use, drinking more, using medications inappropriately, self medicating to cope. The relationship signs. Relationships become stressed with your partner, with your kids, with friends. You're irritable at home. You have no energy for relationships. You withdraw, you isolate, you stop making time for people. If you're experiencing multiple signs from multiple categories, you're probably burned out. If it's been going on for just a few weeks, it might just be a bad stretch. If it only happens when you're working and goes away when you're not, that's a strong indicator it's burnout and not just depression. Let me talk about the overlap between burnout and depression because they share a lot of symptoms and it can be difficult to tease out which one is which. Here's how I think about it. Depression is usually more chronic. It's there all the time, work or no work. It affects every area of your life, not just your job. Burnout is more context specific. It's related to work. It gets better when you're not working. It's focused on your job, not your entire life. Depression responds to medication and therapy. If you treat the depression and the symptoms improve across all areas of your life, it's probably depression. Burnout, however, responds to changing your work situation. If you change jobs or take time off and the symptoms improve, it was probably burnout. But here's the complexity. You can have both at the same time. Burnout can trigger depression. Depression can make you more vulnerable to burnout. They feed on each other. So when I'm coaching someone, I try to identify patterns. Has the depression been treated? Are the symptoms the same or different? Do the symptoms improve when you're not at work? Are you able to enjoy things outside of work? If you can enjoy your hobbies, your family, your time off, but you dread work and feel exhausted just thinking about it, that's more likely to be burnout. If you cannot enjoy anything, cannot find pleasure anywhere, feel hopeless all the time, that's more likely depression. But honestly, it's not always easy to distinguish. And maybe it doesn't matter because the treatment overlaps anyway. Therapy, addressing the root causes, making changes, taking care of yourself. Now, burnout looks different at different stages of your career. For medical students and residents, it looks like developing a lack of interest in anything related to medicine, being annoyed by anything and everything, looking for something different, something better, fantasizing about quitting, counting down to graduation, questioning whether this was the right choice. The causes here are usually the overwhelming volume of work, the lack of control, the abusive culture, the sleep deprivation, the constant evaluations, the pressure to be perfect. For mid career physicians, the symptoms are similar, but the causes are more related to systems issues rather than the medicine itself. Administrative burdens, insurance companies, for profit business disguised as altruistic healthcare, loss of autonomy, moral injury from not being able to practice medicine the way you want. And the sunk cost fallacy comes into play more. I've already invested 20 years in this. I can't leave now. That makes it harder to take action. For later career physicians, sometimes it's similar to the mid career, but sometimes it's different. It's realizing you have 10 more years until retirement and you cannot imagine doing this for 10 more years. It's the accumulation of decades of trauma and stress. It's physical limitations making the work harder. It's changing landscapes of medicine and feeling like you don't fit anymore. The point is, burnout can happen at any stage, and it looks slightly different at each stage. But the core is the same: exhaustion, cynicism, loss of meaning. Let me tell you what happens to physicians who are burned out but keep practicing, because some people do. They recognize they're burned out, but they don't leave. They don't make any changes. They just keep going. What happens to them? Resentment towards the job. Deep, bitter resentment. They hate medicine. They hate their patients. They hate their colleagues. They hate everything about it. Dissatisfaction. Nothing is ever good enough. Nothing brings them joy. They are perpetually miserable. Depression. The burnout often triggers or worsens depression, which makes everything worse. Substance use. They self medicate, alcohol, drugs, whatever they can get to cope, to numb, to escape. Poor patient care. They're not present. They're not thorough. They make mistakes. They just don't care. Relationship destruction. Their marriages fail. The relationship with their kids suffers. They have no friends. They're isolated and alone. And sometimes suicide. Physicians who are burned out and don't get help are at risk for suicide. That's the ultimate consequence of untreated burnout. So if you're burned out and you're just pushing through, hoping it gets better, it won't. Not without intervention, not without change. You have to do something. Let me tell you the most common causes of burnout that I see. Cause 1, administrative burdens, endless documentation, electronic health records that take longer than patient care, prior authorizations, quality metrics, patient satisfaction scores, committees, meetings, all the work that isn't patient care. Cause two, insurance companies fighting for every treatment, getting denied for things that are clearly medically necessary, spending hours on peer to peer reviews, watching your patients suffer because insurances won't improve what they need. Cause three, for profit business disguises altruistic healthcare. Being told to see more patients in less time, being evaluated on RVUs instead of patient outcomes, being treated as a revenue generator instead of a healer, watching administrators make decisions based on profit and not patient care. Cause number four, loss of autonomy. Not controlling your schedule, not controlling how you practice, being told what to do by people who have never seen a patient, having no say in how things are run. Cause number five, moral injury. Being forced to practice medicine in ways that violate your values. Not being able to provide the care your patients need. Having to compromise on quality because of time or system constraints. Watching patients suffer because the system is broken and you can't fix it. Cause number six, workload. Too many patients, too many hours, too much responsibility, and not enough support. Cause seven, lack of meaning. Losing sight of why you went into medicine. Feeling like you're not making a difference. Feeling like a cog in a machine. Note, these are generic. For each person, the specific causes are different. Some people can tolerate administrative burden, but cannot tolerate loss of autonomy. Some people can handle workload, but cannot handle the moral injury. You have to identify your specific causes. What specifically is burning you out? Not just the system. What exact parts of the system? That's what we work on in coaching. When someone comes to me with burnout, here's what I assess. Can they still function day to day in their job? If yes, we can work on intervention strategies within their current role. If no, they need to take immediate action. Leave, time off, change jobs, something drastic. So, what does cannot function even mean? Well, making frequent medical errors, getting patient complaints, being unable to complete their work, having panic attacks before shifts, using substances to get through the day, suicidal ideation related to work. If any of those are present, they cannot keep doing what they're doing. Something has to change immediately. If they're still functioning, though, they're just miserable, then we have time to work on it, to identify causes, to problem solve, to make changes gradually. But we still need to move quickly because functioning while burnout doesn't last forever. Eventually, you stop functioning. So even if they're okay now, we need to intervene before they're not okay. Let me tell you about the Phoenix program. This is my framework specifically designed for burnout mitigation and recovery. It's based on the 5 P's. The first P is positivity. When you're burnt out, everything feels negative. Everything is terrible. Nothing is good. You're stuck in a negative spiral. So we start with positivity, not toxic positivity, not pretending everything is fine, but actively looking for positive elements. Practicing gratitude, appreciating small wins, savoring moments, finding things to be grateful for even when everything feels terrible. This creates a foundation, a base to build from. The second P is purpose. When you're burnt out, you've lost your purpose. You can't remember why you went into medicine. You can't find meaning in your work. So we reconnect with purpose. What are your core values? What matters to you? Why did you go into medicine in the first place? What gives you meaning? And then, how can you align your work with that purpose, even in small ways? The third P is priming. When you're burned out, you cannot see a future. Everything feels like it will be terrible forever. So we work on priming, future visioning. What would your ideal life look like? What would your ideal day look like? What's worth working toward? This creates hope, it creates vision, it creates something to move toward instead of just surviving. The fourth P is planning. Vision without action is just daydreaming. So we create a plan. What are you going to change? What are you going to do differently? What boundaries are you going to set? What conversations are you going to have? What actions are you going to take this week, this month, this year? Concrete steps, specific actions, accountability. The fifth P is physical exercise and play. When you're burnt out, you neglect your body. You stop exercising. You stop doing things you enjoy. You stop playing. So we bring that back. Movement, exercise, activities that bring you joy, things that have nothing to do with medicine. This grounds you. It reconnects you with your body. It gives you energy. These 5 Ps work together to address burnout. Positivity gives you the mindset. Purpose gives you the direction. Priming gives you the vision. Planning gives you the action steps. And physical and play gives you the foundation. Together, they help you recover from burnout or prevent it in the first place. Beyond the Phoenix program, here are intervention strategies that actually work. Strategy 1, identify your specific causes. Not just I'm burned out, but what specifically is causing it? Administrative burden? Which tasks? Insurance battles? Which types? Loss of autonomy? In what areas? Get specific. You cannot fix what you cannot name. Strategy 2, problem solve around your specific causes. Once you know what's burning you out, problem solve. If it's administrative burden, can you hire a scribe, use voice to text, or delegate tasks? If it's insurance battles, can you work somewhere that handles that for you? Can you limit your patient population? If it's loss of autonomy, can you negotiate more control? Can you change practice settings? For every cause, there are potential solutions. Now, you have to be creative. You have to think outside the box, but there are options. Strategy 3, set boundaries. Stop saying yes to everything. Stop taking on extra work. Stop being available 24/7. Set limits. Protect your time. Protect your energy. Strategy 4, take time off. Not just a weekend, but real time off. A week, 2 weeks, a month if you can. Time to rest, to recover, to gain perspective. Burnout doesn't heal without rest. Strategy 5, change something. Your schedule, your patient load, your practice setting, your job, your specialty, something has to change. You cannot keep doing the same thing and expect different results. Step 6, get support, therapy, coaching, peer support groups. You cannot recover from burnout alone. You need help. You need perspective. You need accountability. Strategy 7, reconnect with meaning. Find ways to practice medicine that align with your values. Volunteer work, pro bono care, teaching, mentoring, something that reminds you why you went into medicine. Strategy 8, build a life outside of medicine. Hobbies, interests, friendships outside of healthcare, identity beyond being a doctor. This gives you balance, it gives you perspectives, it gives you something else to live for. Now, here's the hardest question. When do you leave medicine entirely versus stay and make changes? That decision is dependent on the individual, their current place in life, what their goals are. But here's my framework. Stay and make changes if you still find meaning in medicine somewhere, even if it's buried, even if it's hard to access. It's still there. The causes of your burnout are addressable. You can change settings, reduce hours, set boundaries, whatever. And the changes will actually help. You're willing to do the work to recover. Therapy, coaching, making changes, Doing the Phoenix program. You have financial obligations that make leaving impossible right now, but you're building an exit strategy for later. Leave medicine if you fundamentally cannot see yourself doing this anymore. Not just, I'm tired, but this is fundamentally wrong for me. The causes of your burnout are systemic and unchangeable, and you cannot fix them by changing settings or specialties. You've tried to make changes and nothing has worked. You've tried therapy, coaching, different jobs, different settings, and you're still burned out. Your burnout is destroying your health or your life, and staying is literally dangerous to you and your patients. If you have an alternative path that aligns with your values and you can afford to make the transition, there's no shame in leaving. There's no shame in admitting medicine isn't right for you. There's only shame in staying when it's destroying you and refusing to take action. Can burnout be prevented? Yes, in some cases, through the tools I share in the Phoenix program, through intentional career design, through boundaries, through self-awareness, through early intervention when warning signs appear. But let's be realistic. The system is designed to burn you out. The demands are unrealistic. The workload is unsustainable. The administrative burden is crushing. So complete prevention might not be possible. But you can reduce your risk. You can catch it early. You can intervene before it destroys you. Here's how. Monitor yourself regularly. Check in with yourself. How am I feeling about work? Am I enjoying it? Am I finding meaning? Or am I just surviving? Set boundaries from the beginning. Don't wait until you're burned out to say no. Say no early and often. Maintain an identity outside of medicine. Don't let medicine consume you. Have hobbies, interests, relationships outside of healthcare. Build support systems. Therapists, coaches, peer groups, whatever. Have people you can talk to. People who can give you perspective. Take regular time off. Not just weekends, real vacations. Time to disconnect and recharge. Align your work with your values. Choose practice settings that match your values. Don't compromise on what matters most to you. And when you notice warning signs, act immediately. Don't wait. Don't hope it gets better. Take action. That's how you prevent burnout from destroying you. Here's what I want you to take away. Burnout is real. It's common and it's dangerous. It destroys careers. It destroys relationships. It destroys lives. But it doesn't have to. If you recognize it early, if you take action, if you're willing to make changes. So pay attention to the warning signs. Physical exhaustion that doesn't improve with sleep. Emotional detachment and cynicism. Behavioral changes like avoiding work or making mistakes. Relationship stress. If you're experiencing multiple warning signs, you're probably burned out. Don't ignore it. Don't minimize it. Don't tell yourself it's normal. It's not normal, and it won't get better on its own. You have to intervene. Identify your specific causes and problem solve around them. Set boundaries. Take time off. Get support. Make changes. And if you cannot make changes within medicine, consider leaving. There's no shame in that. There's only shame in destroying yourself for a career that doesn't serve you. Your life is more important than your medical career. Your health is more important than your job. Your well-being is more important than what anyone else thinks. So take care of yourself. Recognize burnout before it's too late and take action. I didn't recognize I was burned out until I left clinical practice. And then the symptoms went away. The annoyance, the exhaustion, the lack of interest, all gone. That's when I knew. But I wish I had recognized it sooner. I wish I had taken action earlier, before it got so bad that I had to leave entirely. Now I monitor myself. I watch for the warning signs, and when I see them, I take action. I don't wait. I don't hope it gets better. I make changes. That's what I want for you. Recognition, awareness, action before it's too late. This is In Search of 42. I'm Dr. Felix Boecker, and burnout doesn't have to destroy you if you catch it in time. If this episode resonated with you, hit that like button and subscribe. And leave me a comment about your experience with burnout. Are you experiencing it now? What warning signs are you seeing? What actions are you taking? And check out the Phoenix program resources on my YouTube channel. All the lessons are free. They can help you address burnout before it destroys you. Take care of yourselves. Then let me know what you want me to cover next, and I will see you in the next episode.